stand by, she
Right
said.
here.
Aloha and welcome back to Hi Now Daily. I'm here hanging out at Aloha Laser Vision, hanging out with Dr. Faulkner. We just talked about our scans that we did on my eyes earlier. We're talking all about this Wavelight Plus. And then what did you find? And just tell me a little bit about how this is actually so much more exceptional than anything that you've really been doing.
Well, first of all, I wanted to show you your scans up here. This is what we typically look at to make sure you're a good candidate for LASIK. And this is your OPD scan, and it shows a number of maps of your eye, and it all looks beautiful. Once again, it shows that you have a lot of astigmatism there. Your scans over there show that you are a good candidate for Wavelight Plus. And what Wavelight Plus does that's different is it does build that 3D optical model of the eye. And by doing that and then using the AI and the software to determine what treatment to put on the cornea, it's actually changing your eye from a somewhat imperfect optical system to a more perfect optical system. And the advantage of that is that people are actually seeing better than they've ever seen with their glasses or contacts. So let's say with your glasses or contacts you see 20/20, 20/15. Well, we've had those people coming out seeing 20/10, which means that at 20 feet they can see what a normal person sees at 10 feet. And that's because of the cleaning of the optical surface, basically taking nature out of nature and making it a more perfect thing.
Wow. Okay, now I have to talk about this. You were the first to carry Wavelight Plus here in Hawaii, but only what, one of 6 in the nation?
We were the 6th person to put it in. There are now a few more than 6 out there going on, but it's been a very slow and controlled rollout, basically to people who have a lot of experience and can take this new software and really develop the methodologies of using it. But our results have been fantastic. We have over basically 100% of eyes are 20/20 or better, which is a lot better than we've been able to ever achieve, and that's due to the accuracy of the diagnostics.
Wow.
And we have quite a few eyes seeing in that 20/10 range, which is something that we rarely would see before in terms of vision. And it's been interesting. You ask the patient, like, you know, try not to coax them, but say, you know, how do you see compared to your glasses or your contacts? And they go, Doc, man, I think I see way better than that. And so it's a perceptual difference that they're appreciating.
Yes, I'm paying attention to all of this information because knowing that I have this astigmatism, I really don't even know what it looks like to see something really crispy unless I have my glasses on. But if what you're saying is I could possibly see even better than that,
you could see definitely,
amazing.
yes, as crisp as you see with your glasses, if not crisper.
Oh my gosh. And then, like, talk about downtime. How quick is the procedure? How fast can we get through this?
The diagnostics honestly take longer than the procedure. It takes about 10 to 15 minutes to do both eyes on the laser. We have you go home, take a nap for about 3 hours. When you wake up from your nap, you see quite well. You actually see well when you get up off the laser. Things look a little smoky and foggy, but by the time you get home, that's starting to clear out already, and by the time you wake up in 3 hours, we've had patients come back 4 hours after surgery who are already seeing 20/15 to 20/10. And that's just crazy.
Wow, incredible. The technology over here just always up in your game, getting the best of the best right here at Aloha Laser Vision. Dr. Alan Faulkner over here. If you need to get your eyes corrected, this is the guy. In fact, I'm going to be talking to some of your staff members after who's also got LASIK, and I want to know their experience. So join us when we come back. That's what we're going to be doing. We're going to send things back to Kaino in studio. What's happening?
All right.